Hello, everybody. Good morning. How are you? I hope you're well rested after a very warm and muggy night. Welcome to this Allied Health Professional webinar. My name is Chris Jefferson, and I am an outreach officer for the College of Podiatry. With me today, I have my colleague who you will not be able to see, but you'll be able to hear, and her name is Emily. So hello, Emily.
Hi everyone, I'm also an outreach officer, but I work with the University of Sheffield. I'm here to help answer any questions you might have, so if you have any, put them in the box to your right. I'll get through some as we're talking, but we'll also save a few for the end for Chris to go through. So anything you need, just let me know.
Yeah, thanks very much, Emily. So Emily's job today is the moderator of this webinar. That means she will be answering or fielding any questions that you can ask. There's a little orange button with a white arrow on your screen. Type in any questions during the course of the webinar, and then we will have a sort of a Q&A session at the end of the presentation. This webinar is being recorded, so if you do miss bits or want us to go over bits again, you will be able to get a recording of it. So let's get started. So jobs that make a difference to people's lives. Hopefully this webinar might change your life. If my computer worked, it would change my life as well. Hold on. So what we're going to do today is we're going to introduce you to some careers that you may have never heard of in your life. They are known as the allied health professions. We're going to learn about what you need to become an allied health professional and also answer any questions. But really, we want to give you an overview of this fantastic career sector. The way I've been using these webinars, especially to our audience today, which we're presuming you are between 15 to maybe 18 years old today, years 13, 14. So what I'm trying to achieve, we're trying to achieve with these webinars is to say that if you're looking for a job or a career or thinking about it, essentially you're at that stage in your life that you can do anything with your life. The world is in your hands, literally, hence that slide. So to put things into context, you may be under 20 watching this, but your average life expectancy of someone in the modern world, in the Western world, is 80 years, which means you spend 26 years of your life sleeping, 11 years with being online and watching TV, and 1 whole year of being in school, 365 days, 24 hours a day. Maybe that would be a better way of doing school. Of those 80 years of your life, you're going to spend 3 years going on holiday, maybe not this year, and you are going to be spending over 15 years of solid work, 2 years of hanging around with friends. What I am trying to say, more than anything else, is you're going to spend a lot of your waking hours working. And if you're going to therefore be working, my philosophy is very simple. Find a job, find a career that is interesting and rewarding and, most important, worthwhile. Sometimes I feel it, and today I certainly look it, but I am 45 years old. I have been working for over 20 years and I have had lots of jobs in my time. There are 10 sort of lists up on the screen, which I consider what makes you happy at work. What I'm trying to prove with this bit here is to get you to think, if I'm spending a lot of my life in work, what is going to make me happy? Because I can tell you firsthand, having had quite a few jobs in my life, there is nothing worse than working at a place where you don't want to work, having terrible bosses, doing lots of work and not getting paid for it. So these 10 things up on the screen: being appreciated for your work, getting on with your colleagues and getting on with your boss is absolutely crucial. Most of my bosses I've had in my working career have been absolutely fantastic, and it really does make a difference to your working life. Equally well, when you have a really bad manager or a really bad boss, they can make your life an absolute misery. So those things there are important. It's also important to have a good work-life balance with the amount of hours you work. I originally trained to be a solicitor, a lawyer, and when I was doing my training, my housemates, flatmates at that time were working maybe 50, 60 hours a week. Probably call me lazy. I didn't really want to work 50 or 60 hours a week. Most people work 37.5 hours a week. However, why we work is to earn money. There have been a lot of jobs that I have done where I have earned a little bit of money. I've earned good money, but that I had no opportunity ever to progress or increase my earning potential. I actually had conversations with bosses saying, listen, I've been doing this job for 5 years. Can I have some more money because my performance figures are really good and everything's going really well? I've been told really bluntly, no. So it is really important. I know money's not everything in life, but it is important to at least know that if you perform well and you put your heart and soul into your job, that actually you can get financially rewarded. And financial stability is a slightly different take on this, which means that you want a job where ideally, you know, you're not going to be out of a job. I have spent many jobs, my time doing many jobs in charities, charity work, working in prisons with young offenders, mental health, you name it. And actually all those charities, there have been occasions where I've been into my workplace, I've had a meeting with my boss and they've said, I'm sorry, we've no more money, the funding of the project's finished, you're out of a job, which wasn't great because I was having a family and I had a house and bills to pay, and I went, oh good, through no fault of my own, I was made unemployed. People work for various reasons. Having a good salary is important, yes, but also having an interesting job. And the allied health professions are interesting jobs, that I can promise you. The other thing I think which is brilliant about allied health professional jobs is the fact that you can learn and develop your career. That is a fantastic asset for any job. So what we're going to do is we're going to look at the different allied health professions once my computer decides to play ball. Okay, so before I just briefly explain what an allied health professional is, let me tell you a wee bit about the NHS. Hopefully, from watching the news over the last few weeks, you would have learned all about the NHS and how fantastic all the staff and the support teams have been in helping with the coronavirus crisis. The NHS itself is the biggest employer in the United Kingdom, so over 1.3 million people work for the NHS. And if you could imagine maybe going back in time 5 or 6 months ago and closing your eyes and pretending you were in a classroom, if you looked over to your left or over to your right, someone, at least in an average class of 30, some of your classmates, some people in your year will definitely be working for the NHS in 5 to 10 years' time. Most people, when they think of the NHS, can think of doctors, nurses, surgeons, hospital porters, and maybe midwives. But in actual fact, the NHS is gigantic and it has many, many career opportunities. There's over 350 different types of job in the NHS. And allied health professionals come under an umbrella of that career sector. So allied health professionals are, first of all, professionals, and they work in the NHS. I need to qualify that slightly because not only do they work in the NHS, a lot of allied health professionals can and do also work for themselves, and that is known as private practice. Using an abbreviation, so I don't have to say allied health professional for about 100 times over the next 25 minutes, I might refer to them as AHPs. So what does an AHP do? What does an allied health professional do? Well, very simply, They help adults and young kids, young children, get better, recover from illnesses, and live the best lives possible. They are not doctors or nurses, okay, but they are people who are experts in a particular area or a field of the human body. If you think of a doctor, a GP, general practitioner, they might have an office or a surgery down in your local town or village or in your city. You can go and see them with a problem. I've got a sore leg, I've got a cough, my eyes are very hay fevery. They might be able to treat you. If it's something to do with a specific part of your body, like for example, I've got a really sore foot because I've been doing some exercise, the doctor might refer you to a specialist and a professional. So that might be an allied health professional. There are there are 15 allied health professions. You can now see on your screen the different job titles. I will have to freely admit, when I started this job in January of this year, I had not much of an idea. I could guess, but not much of an idea about what some of these words meant. Thankfully, after 6 months of working, I now have a much better idea about what these careers are. And this is the point of today's presentation, is to get you to think about, oh wow, I'd never heard of that job, or I'd never considered that career. Maybe that's something for me. And the reason we're promoting these allied health professionals is because there are not enough people in the country studying or practicing these professions, these jobs. So if you're looking for a job which there is not desperate need, but there's certainly a need for these professions, these are the careers potentially for you. So if I can say 15 different job careers, that might be slightly too confusing. So what we're going to do, we're going to break it down. We're going to break it down, the allied health professionals, into different categories. So the first 4 that you can see on the screen here are ones that use sort of talking therapies or communication skills to help each other. So we have art therapy, music therapy, speech and language, and drama therapy. What I'm going to do is I'm going to quickly run through the 15 different allied health professions, and then I'm going to sort of expand on each one individually in slightly more detail by telling you a story. So just bear with me while I just go through the next sort of tranche of AHPs. So the 7 here you can see on the screen are the allied health professions which focus more on mobility, being able to move around and live independent lives. So dietitians, you can almost have a guess what they do. They look after people's diets. Occupational therapists help people get back to work. Orthotists are experts in the functions of the eye and how it relates to the brain. Osteopaths deal with skeletal issues. Prosthetists and orthotists deal with false limbs or replacement limbs and external bracing for limbs. Physiotherapy is to do with deep massage, your muscles and your tendons, and they do sort of deep massages and help your mobility. And podiatrist is all to do with the feet and lower limbs. I know it may seem I'm rushing through these, but as I said, I'm going to be going through each one of these. The allied health professional, which most people are familiar with, not maybe because they've received the service, but they've seen with their sirens flashing, driving around, helping people to take them to hospital. We have people who actually work in operating theatres, i.e. when surgery, so they're known as operating department practitioners. And then we have people in the radiography. So we have diagnostic radiography and we have therapeutic radiography. The main difference between these two is a diagnosis is someone doing an examination, and saying that's what's wrong with the person. So they come up with a diagnosis. That's what diagnostic radiography is concerned about. And therapeutic radiography, and again, we'll see this in slightly more detail later on, is actually helping people recover from tumours and illnesses such as cancer. Operating department practitioners are those people who manage what actually goes on in an operating theatre. Right, so what we're going to do to explain this in a slightly different way is to use the story of a fictional character called Jeff. Jeff looks like he's falling over and impaling his head on a giant nail or tack. Unfortunately, that's not what's happening. What is happening to Jeff is all of a sudden he's become very, very ill, and he's suffering really bad headaches and nausea to the extent that he's just vomiting. I apologize if you've just had your breakfast. So Jeff is not well. His friends and his family, loved ones are really concerned about them. So if someone takes ill or has a major accident or a minor accident, what you normally do is you get in touch with your first allied health professional, which is a paramedic. You would phone 999 going, Jeff is really ill. He's collapsed and he's been vomiting. He says his head's really sore. So the paramedics are the first emergency response team. They go to situations where people have called them or they have been alerted to them, and they are normally the first people on the scene if there's been a major accident or people have phoned up saying, help, my partner, my friend, someone in my family is not very well. And as you can imagine, what they do is they do a really important, quick, active assessment on what is wrong with that person. So their decisions are potentially life and death changing. What they generally try and do is assess and stabilize a patient and then make that decision. Do they need to be rushed to hospital? Excuse my sniffles, it's very hay fevery today. So paramedics are probably, as I said, the allied health professions, which you might have heard of the most. So Jeff is getting rushed to hospital. He gets rushed to A&E. The paramedics are using their communication skills, trying to assess. Maybe they've talked to someone from his family going, has he had any history of illness? Well, yes, he's been complaining of headaches for the last few weeks. And so the first thing Jeff is going to do when he gets to hospital is he's going to be scanned. Okay, something to do with the head, we're going to be needing some x-rays, something internal with the body. You break your leg, fracture your arm, you're going to have an x-ray. And that's the job of a diagnostic radiographer. So what they're doing is they're using fantastic technology which can scan the inside of the body, and they try and work out what is wrong with somebody. So already you can see how allied health professionals, they can work as a part of a team, part of a unit, and they're also working with other departments within a hospital or healthcare setting. So these are generally not isolated jobs. It's almost like you're the next cog in the wheel, the next stage of the machine. So the diagnosis of Jeff wasn't great. They reckoned that he had a brain tumor, so a big growth growing inside his brain, sort of pressing. It's under the skull, so it's pressing down in the brain. It's causing a lot of problems with Jeff. So they say, right, Jeff, you're going to need an operation right now. Okay, so poor old Jeff. He then meets his next allied health professional. This is an operating department practitioner. Now, these professionals have a fantastic job. If you've ever had an operation in your life, and I don't think I have. I should know that, so I haven't. Okay, my kids have had. Operating department practitioners are almost like a conductor of an orchestra. If you can imagine an operating theatre, you've got all the equipment, you've got all the machines, you've got tools, you've got scalpels and forceps, you've got blood pressure monitors, you've got lighting equipment, you've got staff such as surgeons and nurses. This environment has to be kept clean, all the equipment and tools need to be ready, and the patient may need to undergo a thing called an anesthetic process. So if you're being cut open, for example, to work out what's wrong with you, generally that would be quite painful. So you would be given an anesthetic. So an operating department practitioner looks after a patient before surgery, during surgery, and after surgery to make sure that everyone knows what they're doing, all the equipment is ready, safe, sterile, and ready to go and clean to use. And so the person you would see just before an operation, just before you're about to fall asleep, would be an operating department practitioner. And when you wake up after the operation, you would see them as well. So they would check that you're okay, you've recovered from the operation, and then you would continue the next stage of your recovery journey. So an ODP, as we call them, operating department practitioners, they care for people before, after, during and after operation, and they make sure that everyone is knowing what they are doing. So they are an important part of the team. After the emergency operation, Jeff's tumor is still there, but the immediate danger has passed. So with the assessment of some doctors and some of the surgeons, Jeff is going to have to continue his treatment. What they're going to do is they're going to have therapeutic radiography. So therapeutic radiographer, they use X-ray machines, CT scans, MRI scanners, and they use, I wouldn't say laser beams, but very powerful radiation waves to target and destroy tumorous and cancerous cells. So a lot of people, unfortunately, will develop cancer in our lifetimes. 1 in 2 of us. You might know someone in your family, or one of your friends might have had it. I've had people in my family die from it. I've had people in my family recover from it. But the job of a therapeutic radiographer is not only to destroy cancer cells, but also to look after the patients. You have to imagine how scary it might be if you're going into a room for your treatment and you see all the big high-tech machines which are making lots of noise. So it's a really not only skilled role using IT and specialist equipment, but you, again, like a lot of the allied health professions, you need really good people skills. Excuse my sniffing, I do apologize. So Jeff has now had his therapeutic radiography, and he's now going to see a completely different type of allied health professional. He's going to see a dietitian. If you think about it, what we eat is actually vital to what happens to our body. If we have a bad diet, poor diet, we drink too much alcohol, which I know you guys don't because you're all under the age of 18. If you eat fast food all the time and don't do enough exercise, that is not good for your body. So dietitians work with the other health professionals on trying to come up with a balanced, nutritious, practical diet to help patients. 1 in 2 of the UK population, 50% of the UK population, have been diagnosed as obese. According to the papers on Sunday, technically, half the population, we are fatter than pigs. That may be down, I think pigs have an average body fat content of 17%, and nowadays humans seem to have 27%. That I would probably say lockdown hasn't helped things, but an unhealthy diet can lead to a lot of health complications. So it is up to the job of a dietitian to learn about the patient, to talk about the patient, find out what they do with their lives, their lifestyle, and if they need to lose weight or gain weight after before and after operations. That is the job and the recommendations of a dietitian to do. A lot of people have eating disorders. They might have allergies. You might have things like celiac disease. You might be gluten intolerant. You might be allergic to peanuts. All these things, the purpose of a dietitian is to make sure that what you put in your body is good for your body. Once Jeff is back on the road to recovery, he might therefore also meet one of the other types of therapy that I mentioned, the music, drama, and art therapy. So what they do is they use the power of music, the power of art, and the power of drama to help communicate with their patients. If you can imagine a young child or an elderly person might be feeling very ill, but not know how to communicate it for whatever reason. Maybe they've got an emotional disorder, or they've got a behavioral or learning disorder. They might have had a knock on the head. They just might not be, they might be paralyzed. They might be recovering from a coma, you name it. They might need extra help. So music, drama and art therapists are slightly different professions from the other allied health professionals, as we will see in the way that they become an allied health professional. But if you think how good your favorite song is, if you listen to it and, oh, I'm feeling quite depressed, right, I'll listen to that song. The emotive power of that song, or a favorite film or a play, or the fact that if you're feeling depressed or you're feeling unwell after an operation, actually working with others, doing something, focusing on a task, learning a play, learning a comedy, acting out something, it's all very powerful stuff and very good for your mental well-being, therefore your physical well-being. So our next allied health professional is the occupational therapist. Now, I know the cartoon looks like someone is doing how to do some welding, maybe sort of welding a ship together, but that's just a sort of, I think, a example of different types of jobs. So the word occupation is essentially a job, a career, a profession. What do you do for your occupation? I do this. This is what I do for a living. So an occupational therapist, their main role is to get someone back at work, someone who's been ill, hopefully on the road to recovery, and they go and meet the patient. They talk to them using their communication skills. They might visit them in their house, in their home, and they might also go and visit where their patient works, their place of work. So these type of allied health professionals may not work in a hospital. They might work in a healthcare setting, that might where their office be, but you can imagine this type of role is one which isn't primarily based in a hospital. And this is a sort of a theme with all the different allied health professions. Some of them work solely in hospitals, some work sometimes in hospitals, and some may never work in a hospital. So when I say healthcare setting, it could be a healthcare center, it could be a private practice, it could be a GP surgery, it could be a hospital, or you could be working from your own home or an office. So I know everyone's been really worried about Jeff, so I would like to say, put your minds at ease, Jeff has got better. Right, it is absolutely roasting in my house at the moment, really hot, and I've got all the doors closed so I don't hear any noise from the kids and things, so I am sweltering. So spare with me a second, I just need a small glass of water. I'm going to look at 4 more allied health professions. Not because I work for the College of Podiatry, even though I do. We're going to look at 4 allied health professions which are most in demand. So of all the allied health professions, the 15 different ones, there are 4 in particular which there is a real need for young people and old people, if you want to retrain, to become and have a fantastic career. The first one is podiatry. Podiatry, maybe 10, 15, 20 years ago, it would have been known as chiropody. I'm a chiropodist. Podiatrists they are experts and professionals with the feet. It is not just the feet, it is also the lower limbs and the ankles. Over 25% of the bones in our body reside in the lower limbs and feet. Quarter of 4 times if you run or tread heavily, 4 times the force of gravity are going through your ankles and your feet, your muscles and your tendons there. The average person walks over 125,000 miles in their lifetime. I have a sore left foot at the moment, sort of the back of my foot, because I took up retrospectively stupidly, took up jogging up and down my garden a few weeks ago, thinking, right, I'm going to use this time to get fit, and because I'm old and not fit, one day I couldn't walk. So I'm going to have to see a podiatrist at some point. So podiatrists, yes, they deal with the feet. They are experts in this area. Imagine how important it is not being able to use your feet and limbs properly, or if it's painful. So podiatrists can work in the NHS. They also, a lot of them do work in private practice. They also help with people who have injured their feet and their ankles, such as sports stars or athletes, or people who do dancing or running. Also people who have got long-term health conditions, so people who have got arthritis or people who have got diabetes. They will help them as well. A lot of people who have diabetes, 17% of people who have type 2 diabetes end up having an amputation of a limb. So before that stage happens, ideally a podiatrist would work that you might be at risk of having your foot cut off, and so they would come up with exercises and footwear and other recommendations of what to do to prevent your foot being cut off. If your limb, well, this is a bit grim in the morning, isn't it? So if you have your foot cut off or your arm amputated or your leg amputated, you would ideally want a replacement limb. Of all the allied health professions that I've been talking about, a prosthetist and orthotist are the ones which are more focused on design, technology, and I would say the STEM careers, science, technology, engineering, and mathematics. So it is practical. It's practical in terms of someone will come in with needing a new limb, and your job is to make one for them. Or someone comes in with a limb which is still there, but your job will be make a support for that limb. So the main difference between a prosthetist and an orthotist, try saying those words 10 times in a row. So a prosthesis is an artificial limb, and an orthosis is almost like a limb bracing or a piece of external scaffolding. And to explain or to demonstrate, I have here a orthosis. This here is bespoke made, so it's made for one patient, so it fits one person. A cast was made of that person's lower limb, and the orthotist therefore took the cast and then got some carbon fiber sheets, made the shape, put them in the oven to bake at 3000 degrees, so a bit different from baking some buns or scones, and then sculpted it into this fantastic device. What this does, it helps prevent a condition called drop foot, where your your foot muscles, ankle muscles are all sort of floppy, and you end up dragging your foot, which means that obviously you could fall and trip over and cause a lot of damage to yourself. So carbon fiber, this is really light. I think this would cost about £300. It's the same material as they would use in a Formula One car or a fighter jet. Prosthetics and orthotics are that area of an allied health professional where you would make such a difference to someone's life. If you imagine someone who's had an injury where they've had to have a limb amputated, they will be not used to not having that limb, so the difference you can make to their life is going to be absolutely amazing. Some people are born without limbs, and some people have long-term health conditions, which means that they have to have their limbs amputated as well. So you're really working with patients, but you're also coming up with loads of creative solutions using design and technology, computer-aided design. If we had the Olympics this year, after the main Olympics, we have the Paralympics, and without doubt, you would have seen loads of para athletes running around or doing whatever sport they have, maybe using a prosthesis. A lot of ex-service people, obviously they have suffered horrific injuries during times of conflict, so a lot of ex-service people, they use prosthetics as well. So it's a long-term, short-term and medium-term help of your patients. Two more to go through in our sort of 4 most that need allied health professions. We have orthoptists. Orthoptists are not opticians. So an optician is someone, yes, they both deal with the eyes, but an orthoptist is more specialized than that. They look at the relationship between the brain and the eyes. The eyes are obviously connected to the brain, and so an orthoptist will deal with things like head injuries or long-term conditions where you might have had a stroke, or you've got problems communicating, you might have developed a squint. And so that is what an orthoptist does. They are looking at how your eye muscles work, how the nerve ends are connected, the nerve development. If you're suffering blinding headaches all the time, they are the people who are going to help you get better. They can prescribe practical treatments such as eye exercises, prisms, which are little triangular inserts into your eyewear. If you have ever seen a young person in school wearing an eye patch, that's because they've had a condition called lazy eye. Lazy eye is a bit of a misnomer, i.e. sort of gives the wrong impression. Lazy eye is not because the eye muscles are lazy, it's because the nerve development in the eyes hasn't formed properly, or it's just a bit behind schedule. So what they do is put an eye patch on the good eye, which means that the lazy eye, that's going to help sort of G up and get the nerve development of your other eye on working better. A lot of orthoptists work with kids, and they do a lot of preventative work as well, so that you might have been even visited by an orthoptist. And again, they can therefore work not only in hospitals and healthcare settings, but they also might have their own private practice. They might have to work for the military, they might have to work for the armed forces, the police, the emergency services, assessing people's eyes, pilots and other people in public transport, as well as schools as well. So a very varied and interesting career. And the last of the allied health professions, which I said are most in need, is therapeutic radiography. I have mentioned this in our sort of story about Jeff, but just to go over it once more, they target and destroy cancerous and tumorous cells using radiation waves. If you think about it, a radiation wave, it can be potentially dangerous because it can kill good, healthy cells and as well as the cancerous cells. So your average radiography course to treat cancer is 7 weeks long. So that by that time you're going to meet a patient, you're going to learn about their life. Hopefully you will see them at the end, all the way to the end, and be able to give them the good news of what's happening. You're going to have to put very nervous people, very worried people, not only the patients themselves, their family as well, at ease and be able to explain what you're doing. And there are going to be times where you are unfortunately going to have to tell that patient that the radiation treatment hasn't worked. But therapeutic radiography, you can work mostly in hospitals, because if you imagine the machines are absolutely gigantic. Yes, you have mobile scanning machines, but generally you'll be working in a department of radiography. And the career prospects are brilliant. You can specialize in certain areas of radiography, certain cancer treatments, tumor treatments. You can even design. You might think, well, there's a better way of doing this. You become a manager of a department. You can become a professor, a tutor. One of our colleagues who works in our team is a therapeutic radiographer, and she's absolutely wonderful. Has had, it seems, from all accounts, a wonderful career. And she absolutely loves it. She loves the fact that she works for a team. She loves the fact that she can work with patients. And she loves the fact, like all allied professionals, she makes a real difference to people's lives. I'm just going to zoom through that slide. I just have, so you'll never have to see it again. Okay, why be an allied health professional? Why? Lots of reasons. If I was your age and watching this, I would actually want to become an allied health profession. It costs a lot of money to go to university. The average tuition fees, so when you go to university, you pay the university to teach you, and the average fee is £9,250 every year. So roughly around £30,000 for a 3-year course. If you go to university, it also costs you money to live, to go out, to socialise, buy equipment, buy books. So they reckon between the average 3-year course will cost you £50,000 to £60,000, which is very expensive. And I've got 3 kids. Thankfully, they're not too, well, in the next 10 years, I'm going to have to fork out £150,000 for my kids to go to university. And I don't have £150,000. And if I did have £150,000 for them to go to university, I'd want them to study something which means that they can get a job. I am not dismissing any university course, but there is a danger. If you do a soft subject such as history or geography or I don't know, French Romantic poetry, yes, you might be interested in that as a subject, and yes, you might get a job in that area, but there's also very, very likely that you would come out of university owing lots of money. I know you can get student loans and not get a job. However, if you study an allied health profession, there is a 92% chance that you will get a job. Essentially, go to university for 3 years and you will come out and you're pretty much guaranteed a job as an allied health professional. And that is an amazing statistic. Once you graduate, you can go onto the NHS job site and go, oh, look, there's lots of jobs for me. I can go there and I can start my career. Or you can also work in private practice. So private practice is essentially working not for the NHS. You can even work for yourself. Generally, what most AHPs do is they get a few years under their belt as an allied health professional in an NHS setting. That might be because you have to learn by doing, you're going to get more experience, and you might, after a couple of years, think, actually, I like working with these type of patients, or this area really interests me. And if you work for the NHS, they are a fantastic employer in the sense that they will recognize your skills and your dedication, and they will offer you to go on lots of training courses to increase your skills and knowledge as well. Being an allied health professional is quite different from a lot of jobs because you have a chance and opportunity to specialize in a certain area. Normally, when you apply for a job, there is a job description, could be 2 pages long, could be 1 page long, and that's it. You do that job, and you do that job as long as you're interested in. Some employers might go, hey, you're really good at this. Have you thought about doing something else within our company? Having spent most of my life working for charities or in the cultural sector, I've actually, truth be told, I've never had a job where someone's gone, Chris, you've been really good at this job. Do you fancy doing something else within our company? Which means 2 things. Either those career sectors mean you can't progress and develop, or I'm not a very good employee. And I don't really know the answer to which one's which. That's enough about me. Other great things about allied health professionals. Generally, you can work core hours. Core hours are 9 to 5. So the average job is 37.5 hours a week. So core hours are you get up, get out of bed. I'm not going to sing the Beatles song. Have your breakfast. Maybe you walk to work. Nowadays, a lot of people are working from home. That might change in the future. So you might have to get on the bus, you might have to drive, might have to cycle, get on the train, arrive to work for 9, have a bit of a lunch break, finish work at 5, do the same journey home, get home. That is core hours. And a lot of allied health professionals can do that. And that is quite important to a lot of people. Because as you get older, you might meet someone, you might go, hey, let's move in together, let's buy a house, let's have a family, let's get a pet, let's get a goldfish. And it's nice to have some stability in your life. So having a job which means you're doing a night shift may not be your cup of tea. I've had jobs where I had to get up at 5 o'clock in the morning. I finished at 12 in the afternoon, but then went to bed in the afternoon and couldn't really go out in the evenings because I had to get up at 5 in the morning. I actually quite liked that job. It was quite good fun. In terms of qualifications, if you're studying GCSEs and A-levels, each AHP has different entry requirements, which we will talk about very quickly in a minute. But generally, you're looking from grades from C's to maybe up to 2 A's or an A and 2 B's. There are also equivalent qualifications that you can do, which are recognised by the individual institutions and universities. So don't be put off if you're doing things like NVQ. So like an NVQ level 2 is the equivalent to a grade 2 these days at GCSE. And here's the best bit. When I mentioned it's expensive to go to university, which it is, the government, in their wisdom, have said, right, we need more allied health professionals. So we are going to give you, if you decide to study to become an allied health professional, £5,000 a year free. Minimum £5,000 a year. So all the allied health professionals, apart from art therapy, drama therapy, music therapy, and osteopaths, you will get £5,000 a year free. And if you study the allied health professions I have highlighted in orange, you will get an additional £1,000 a year. That means you don't have to pay it back. So if you wanted to become a podiatrist, you will be given £6,000 a year free. Don't give it back. Spend it on books and learning equipment, not beer and things like that. So it doesn't pay for your tuition fees, but it pays for your living costs. In actual fact, there are, depending on your individual circumstances and where you live, there is an opportunity. If you have family commitments and things like that, then you can actually even get some more money. But all that information will be available on our website. The average, so let's talk about money, okay? Life is pretty expensive. What happens is you are maybe a bit shielded from the reality of life when you're in school. You go, oh, okay, I'm very used to having free music, free TV, free internet, free mobile phone contracts. But at some point, when maybe in your late teens, early 20s, you realize actually life is expensive. And the reason people go to work is to earn money. The average graduate, when they finish university, they may start a job, and the average starting salary for a graduate is £23,500. The minimum starting salary for an allied health professional after 3 years is £24,000. So what you can see up on the screen here is the NHS pay band scale. So when you start a job, you generally start at the bottom because you've got the least amount of skills and experience, even though you might be a graduate and done the training. Generally, you start at the bottom and you work your way up. So after a couple of years, you might go from band 5 to band 6, and then band 7, and then band 8. I have met a speech and language therapist in a school a couple of months ago, just before lockdown. They'd been in the job less than 10 years, and they were entering band 8. So from starting at 24, they were nearly double their salary within 10 years. There are not many jobs that offer that opportunity. As I've said, I've worked for organizations for up to 5 years. I've asked for more money and their answer was no. If you don't like it, you can leave, which wasn't very nice of the company. Excuse me, but that's the way it was. You just have to bear with me. Once you get past band 8, you're now looking at more senior management roles. So this pay band salary is based on the NHS. However, career progression is one of the main assets and benefits of becoming an allied health professional. So once you get to know what you're doing, they reckon it takes 10,000 hours to become an absolute expert in anything. And after 1,000 hours of training or practice, you should be competent in something, which probably explains why my son is very good at Fortnite, because he's probably played it for 10,000 hours. It's still involving jumping around like a kangaroo, in my opinion, but there we go. So there's nothing stopping you, in theory, from earning quite a lot of money as an allied health professional. The average house costs £210,000. The average deposit for a house is around £60,000, and most people don't buy a house until you're 31 years old. The nuts and bolts of this are, if you want to have a good salary and the potential to earn good money in the future as well, an allied health professional is a really attractive job. If you work in private practice, you could, you say, I'm going to be a podiatrist, but work for myself, not the NHS, or a physiotherapist or speech and language therapist, you can earn more money than the NHS offers, potentially, because you can work with, you can be a specialist or work with private clients and charge them what you will. However, if you work in private practice, you're going to have to own your own business. You're going to have all the administrative costs of insurance and owning equipment and buying or renting premises, all that. So it's all swings and roundabouts as well. What a lot of allied health professionals do is after a couple of years, they go, maybe 10 years, they've met friends, they've developed friendships and good relationships with colleagues. So they might spend 2 or 3 days working for the NHS and then spending the rest of the time as a private consultant as well. To become an allied health professional, so we had dozens, if not, well, over 100 people watching this professional presentation, or at least this presentation today. I know all of you now are going, Chris, you've changed my life. I really want to become an allied health professional. I want to make a difference to people's lives, and I want to earn lots of money and have good career progression. What do I need to do? Well, very simple. You need to go to university for 3 years. And you're going to have a really good time at university, not because it's a fantastic place to go, but because the courses are very varied, they're mixed, the modules are interesting, and it's a mix of not only just going to lectures and tutorials, you're actually also going to go out on placement. So you will go to hospitals or healthcare settings. You will learn on the job from shadowing other health professionals. And you will actually get to practice and treat real people and patients as well. All that can mean that courses can be intense, but they will be rewarding. And remember, after 3 years, that's it. You've done your training and you can walk into a really well-paid job. So I said at the start of the day, at the presentation, that life can be what you make it. You have the whole world in your hands. You're going to spend a third of your life at work. But I would say, as I said about 10 minutes ago, if I'd watched this 25 years ago, I would have said, Chris, you look old. What are you doing talking to yourself? And I would say to myself, Chris, why don't you consider one of these jobs? It can make a difference to people's lives and it's interesting. And that's the secret of life, to do a job which is interesting and rewarding and a challenge. All the allied health professionals I have met, they say it's a brilliant job. It's full of camaraderie. Every day is interesting. You're meeting patients, sometimes very briefly, sometimes you're working with them for a long time. You can develop yourself professionally. You can go from being a standard prosthetist and orthotist to being a professor specializing in things, inventing stuff. It is amazing. To find out more, you can look at our website, which is iseethedifference.co.uk. So if you want to learn anything about this presentation, anything about any more of the other allied health professionals, all you have to do is tune into our website. It's a really good website as well. I'm not just saying that because it's our website. It's really easy to navigate. It's really straightforward. From there, you can find out the links to every individual allied health professional, what a day in the life of a podiatrist looks like, or a therapeutic radiographer, or a occupational health therapist, or a operating department practitioner, what grades you need from the individual institutions and universities, where you can study. It just gives you all the detail. Also, we have the fantastic Emily today. Well, she's always fantastic, but for today especially, because she will be answering any emails. So if you info@iseethedifference.co.uk, any emails that you want to ask, any questions via email, please ask. We will get back to you. And just general info, keep up with us on Twitter and Facebook and Instagram. So now we have our Q&A session, where you guys have hopefully been going, wow, I've got loads of questions, and between myself and Emily, we will do our best to answer them. So we've got about 10 minutes or so, not maybe more, maybe less, of a bit of Q&A. So now's your time. Type them in. Maybe you have. So Emily, do we have any questions?
Yes, we've been having a lot of great questions come through, and they're still coming. So if we don't get a chance to answer them right now, I just want to say that I will be going through this afternoon and just sending you a quick email if we don't get to your question. So it will be answered. I'm just going to go through and pick out some which I think a lot of people would want to know.
Okay.
So first up, is work experience compulsory for studying AHP related courses at uni?
No, it is not. However, it is recommended. Yes, these AHPs are in demand, but the university will still want to know about a wee bit about yourself, why you want to do this career, what are your interests are, and like anything in life, the more that you make yourself stand out from the competition, the better it is. So it's not compulsory at all, but I would certainly recommend it, even just to see if you like that, to see if you're interested or you actually like it. It's always good to talk to someone in a career that you're interested in going into, so then you can go, yep, that sounds like I want to do, or no, that sounds terrible, I'll choose something else.
Okay, great. Next up, could you just briefly describe the role of speech and language therapist?
Yes, certainly. Speech and language therapies. Okay, so what they do, I'm just going to get a note out because I don't want to say speech and language therapists. They are essentially dealing with communication skills. So people who they can work with young people. So maybe sometimes babies are born with things like cleft lip palate, which is when your bones of your mouth haven't formed properly, so they may not be able to form or their words properly. So some people who have had mouth injuries may not be able to speak properly because you might have had oral cancer and had half your tongue removed. So what they're doing is maybe part of their role is to help people learn how to talk again or learn how to communicate again. If you've had a long-term illness or you've been born with a disability, you might not be able to communicate. So it's essentially teaching people to form how to speak again, how to communicate again. People might have problems eating or drinking or even swallowing. So you might have had, for example, my father-in-law had throat cancer, which he recovered from, but he had massive problems swallowing and tasting and actually talking for a while. So he met a speech and language therapist. So things like cleft palate, stammering, what else? Working with people who've got voice disorders. So you could be working in hospitals, private practice, and visiting people in their own homes as well. But really what I would recommend is to go through our website, look at that in a lot more detail, and also the College of Speech and Language Therapy.
Okay, you've just frozen on my screen, Chris. I'm not sure if that's a problem for you or me. Oh.
I'm sorry. There was. Seems I had a little there. My computer's now saying I lost audio. Did you hear that?
You froze for me. I'm not sure anyone else still heard you.
Okay.
Also, I don't know what's going on with your camera now, but it's doing something interesting.
Go on to the next question. Anyone who's listening still, which I know you are because I can see how many people are watching, apologies, I'm having a bit of an IT issue at the moment, but hopefully you can still hear me now.
Yeah, I can hear you now.
Okay, so
oh no, Chris, you've gone again. I think as it's 11, we'll call it a day there. But rest assured, if you've got any questions that you've put up but we haven't answered yet, I will get through them hopefully by the end of today. And feel free to send us an email as well.
Okay, Emily, can you do me a massive favor if you can still hear me? Would you? I know something's going on with my IT at the moment. For those of you who can still see and hear me, thank you so much for tuning in today. I'm really sorry we didn't have any more time to go through the questions. We will email us, and we promise you we will get back to you as soon as possible with the answers to your questions. And this is the first time in a month and a half I've ever had these problems with the audio, so I'm really sorry about that. Emily, if you wouldn't mind saying goodbye, just in case people didn't say hear me, that would be great.
Sure. Okay, like I said, we will get to your questions. Thank you so much for joining us today. We hope it's been really interesting and you've learned something and are now considering an AHP, because that's what we're here for, to tell you all about these wonderful professions. So give it a look, make sure to check out our website, and thank you for joining.
Thank you very much, everybody.